Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. This is the weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases, outbreaks that you need to know about. And I do this with my friend and colleague, Dr. Jon Epstein, veterinarian virologist and disease ecologist, who, like me, has spent his career tracking dangerous infectious diseases across all corners of the earth. Thanks, Jon, for joining me today.
Jay, happy Thursday. How's it going?
Yeah, good. It's good to see you. And I think we've been getting pretty good feedback on our new approach to basically just doing a lightning round of diseases of interest. And so I think that's what we're gonna do today. And then of course we'll have our focus topics as well too.
I think it's good. I think we get to cover a bit more of the news, a few more topics, and it's kind of that what's gone on in the past week, and then we'll focus on something and dive in a bit deeper. But yeah, it's pretty fun for me too.
Yeah, I know. I mean, one of the things that I think that I brought up last week, but I published this week was, it is Halloween week, and
Yeah.
and kind of what I've been calling sort of the public health horror story, which is, if you look back at, we talked a little bit about this, but like a little over 10 years ago, CDC released a guide to how to survive a zombie apocalypse, and it was a graphic novel, and it was kind of meant to highlight how we need to be prepared for every hazard out there, and also how CDC prepares. And I think a lot of us are just really, Halloween is a great holiday in New York, just an incredible party for kids and adults throughout. But, we're obviously keeping in mind all the horrors that are going on with so many of our colleagues out of work right now.
I know.
Some of the Americans who are suffering right now especially because of health insurance, but even things just as fundamental as food benefits.
I know, it's true. I think the Halloween horror story right now is the government shutdown because, there's a number of things we could talk about, but most pertinent to these conversations we're having is we are flying blind when it comes to infectious disease. So many of the surveillance and reporting systems have been shut down, and the data is just not coming in from the states and federally to let us know what's going on with things like flu and COVID and other things that are particularly seasonal this time of year.
Yeah, I mean, it is interesting. I think this is not grounded in hard data, but every week before we do our show, I kind of review. We've talked about Beacon, we've talked about all sorts of like Health Map and the Pandemic Center at Brown and a number of other places that scan the internet to look for news about outbreaks, and there were actually not quite so many in the past 1 or 2 weeks. And as a public health person, there's basically two explanations. One, disease rates have gone down for whatever reason. But the other is people aren't looking as carefully. And I have to suspect and believe, especially, this is a time of year when people are gathering, particularly they're getting back to work, they're getting back to school. It's a time when we actually see a lot of communicable diseases. So I have a suspicion, not verifiable, that, some of the less reporting that I'm seeing about infectious disease events may be related to some of this shutdown and the defunding of public health.
Yeah. And, we've also covered the messaging that's coming out about vaccines, but it's a good time to, remind folks that this is the season to get your flu shot and your COVID shot. Okay. The updated COVID vaccine is available. It covers the current dominant strains and variants that are circulating. I got mine about 2 weeks ago, and I feel like this is the right time to get that protection up.
Yeah, this is actually a great time, the mid to late October. I got my flu shot in my clinic a few weeks ago because they were essentially walking around. The nurses were walking around and giving it. And then I got my COVID vaccine separately, about a week or so. Yeah, a week and a half ago or so. So just went to a pharmacy. And thankfully here in New York, widely available. You don't have to somehow justify why you need it. Just wanting to stay healthy and reduce the risk of severe illness and long COVID, cardiovascular complications, all the many benefits that you get from boosting your immune system. The most effective way that we know to boost our immune system, which is not by supplements or vitamins, but by vaccines.
That's right. And especially this time of year, getting into the fourth quarter, into the holiday seasons, more parties, vacation and travel, the kinds of things that generally expose us to respiratory illnesses and whatever's floating around in wintertime. So it's a really good time to boost our immune system against those things.
Okay. And so let's now jump right in about some things that we can boost our immunity to things and some things that we actually need regulation and monitoring to protect us from, because our immune systems isn't enough to handle it. So item number one this week on our outbreak rounds, Shiga toxin E. coli in the Pacific Northwest. So there have been 3 confirmed cases of what's called Shiga toxin producing E. coli linked to Twin Sisters Creamery, which is a dairy that sells aged raw milk cheese. And
Yeah.
these illnesses have affected 2 residents in Washington state and 1 in Oregon, including a child under 2 years old. And so, John, this gets to the a question that comes up a lot, or an issue that comes up a lot, which is the question about like what is the risk from eating any type of dairy products that haven't been fully pasteurized?
Yeah, it's what we say about really any raw, undercooked food. There is a risk of bacterial infection, first and foremost. And the process of pasteurization, the process of heat treating food is what reduces that risk of bacterial infection. And so in this case, we have an E. coli strain. E. coli is a very common bacteria. We all carry it in our guts, but this particular strain can produce Shiga toxin. And if you're unfortunate enough to eat food that's contaminated with it, it can cause a really bad sickness.
Yeah, and the thing that we really worry about the most is, E. coli is a bacteria that we have in our guts. It doesn't normally cause us illness, but there are strains of E. coli
Hmm.
that are much more dangerous. And there's many different strains. They can produce certain toxins that are associated with severe stomach illness. But one of the things that's most worrisome about Shiga toxin producing E. coli is, it's probably famously known to people of a certain age as the Jack in the Box E. coli, with a huge outbreak.
Right.
Like probably in the early 90s, I guess,
Mhm.
associated with E. coli, what was then E. coli 0157H7, that was associated with ground beef. This is a different strain of Shiga toxin producing E. coli, but it produces one of the same fearsome complications, which is you can get damage to your kidneys as well as damage to the blood cells in your body. And it's called hemolytic uremic syndrome. And it can be devastating, particularly for young children.
That's right. And of the cases that we're talking about here from the creamery, one of them was a young child, right, Jay?
Yes, it was. And they haven't told us about whether that child had what's called HUS or hemolytic uremic syndrome, but there was a report that one person was severely ill and hospitalized, which to me is suspicious and would suspect that that might be the case, but it hasn't been publicly reported at all.
Yeah, and it's worth mentioning kids are particularly susceptible to gastrointestinal infections. Their guts are still developing, they're immature, and they're more susceptible to bacterial infections. They get more severe symptoms sometimes. So we have to be really careful with giving kids, raw and unpasteurized foods. Because of that susceptibility, adults are just a little bit more resistant because they have a fully formed gut.
Yeah, and the other thing that a lot of people may not realize is, especially me, I'll see patients who come to my clinic and say, "Oh, doc, I've been having a upset stomach and diarrhea. Can you give me antibiotics for it?" And Shiga toxin producing E. coli is part of a group of pathogens that, infect your stomach, that actually receiving antibiotics can actually be more dangerous. It can
Hmm.
alter your gut immune system. It might result in the release of more toxin. I think that's unclear. But this is a condition, unfortunately, where only things like what's called supportive care are needed, and that actually receiving antibiotics can actually potentially worsen your illness.
So again, yeah, this relies on diagnosis, doesn't it, Jay? There has to be a good lab test that tells you exactly what is causing your symptoms. If you're coming in with GI distress, upset stomach, diarrhea, vomiting, it's not just, hey, you may have a bacterial infection, take some antibiotics, but now it's important to know what type of bacteria is causing your symptoms.
Yeah, absolutely. And it's one of the reasons that sort of standard guidelines are that people who come in for medical care who have some type of gastrointestinal symptoms that sound like an acute stomach illness or acute
Hmm.
intestinal illness, we generally don't provide antibiotics, and that we do perform laboratory testing so that we can verify that in fact it is one of the pathogens that will get better with antibiotics, as opposed to, or at least reduce shedding, as opposed to potentially make things worse.
Yeah. And again, just to put a positive light on this story, we found out about it. We heard about it. It was just 3 cases, but the system is working in this instance where the cases were identified as a cluster, a common source exposure, right? They all had exposure to the same food products, and that got out into the media, which is important. And hopefully locally it got out into the mass media, traditional media, not just, geeks like us to paying attention to this stuff, but to prevent other people from, eating the same types of food that may also be contaminated.
Yep, absolutely. And on the topic of food and risks potential to our food supply, both the safety of it, but as well as the price of it, bird flu is in
Mhm.
fact back in the United States.
Surprise.
And as you and I talked about a few weeks ago, turkeys, which are an important food commodity for Americans in November, right? This is Thanksgiving is coming up just a few weeks away.
Yeah.
Turkeys are now getting bird flu, and this could have a really devastating impact both on the lives of turkeys, on
Hmm.
the safety of the food supply, but also on the price of food. So, avian flu activity, bird flu, is increasing across the country. In the past 30 days, there have been confirmations made in 62 flocks, including 34 commercial flocks, with over 6 million birds affected. And the highest activity, or the biggest increase in activity, has been seen in Minnesota. And notably, that involves a large commercial turkey farm in Swift County, Minnesota, that houses 34,000 turkeys. And that is the latest site of a massive outbreak that's occurring around in bird flu and will affect our turkey supply this coming Thanksgiving.
Yeah, people may wonder how the numbers get so big, and it's important to remember that our food industry in the United States is very centralized. We have massive, massive farms with millions of chickens, hundreds of thousands of turkeys, thousands or millions of cattle. We mass produce livestock, and then it gets distributed out to the other states. So when you hear about these outbreaks in states like in the Midwest, it's because that is where our agricultural industry tends to be concentrated. And once a viral infection like flu gets into a poultry flock, it spreads like wildfire, and there are literally millions of susceptible individuals ready to be infected. And unfortunately, not only is this a devastating disease for poultry, but the solution is to depopulate that farm. So suddenly the food supply gets impacted pretty significantly, which is why we see increased prices in poultry and eggs.
Yeah, exactly. Okay, now we're going to move overseas to a disease that is something that I'm particularly interested in. I'll explain in a moment. But both the disease and the location may feel a little esoteric to some people.
Hmm.
So this is about diphtheria in Somalia. So it turns out that there are currently large diphtheria outbreaks that are occurring, basically in the Horn of Africa, extending over even to Yemen. So this includes Somalia, Sudan, Yemen, and Chad. These are all countries in a similar region of the world that are also experiencing civil wars and large populations of refugees. And what you're seeing is a very large outbreak of this bacterial infection that produces an extremely dangerous toxin that essentially strangles people. Like, it causes so much inflammation in your throat that
Hmm.
you can die from that. Additionally, there are some strains of this bacteria that can produce a toxin that is extremely dangerous to your heart. Now, this is a vaccine preventable disease. So, really, the main reason that you're seeing these outbreaks is that basically these are populations of the world where people do not have access to vaccines right now, particularly because of the civil war and large migration of people who are now really accessing the healthcare system.
It's we're going to see more and more of these diseases that impact refugee camps in war-torn areas. I remember in eastern Bangladesh, the Rohingya are a marginalized community, and there are these big, big internment camps. That's the wrong word for it, but basically, they were driven out of Myanmar. There was a population in eastern Bangladesh, so these refugee camps formed, and the health issues are just horrific, and you don't always hear about it in the news, but high concentration of people, low sanitation and hygienic standards, plus incredibly stressed and stressful situation leads to disease outbreaks, and they get pretty bad.
Yeah, and the one of the reasons I wanted to bring this up is that, after this new administration came into office and RFK was nominated to be the health secretary, I immediately became concerned about, well, basically about our entire public health system, but particularly
Hmm.
three infectious diseases. One is measles, which we have seen a resurgence of. The second is tuberculosis, and that, again, airborne disease that requires aggressive public health measures. We haven't seen increases yet, but that is a more of a chronic type of infectious disease where you're going to see delays a little bit later. But the third was diphtheria. And the reason I bring up diphtheria is because it's one of those diseases that really does require high vaccine coverage. It's easy to for people to acquire and transmit because some people can basically spread it to other people, and you need to have that vaccination inside of you. And when you pull back vaccination rates, you can get devastating outbreaks. And the reason I originally I thought of this as something to be concerned about is this is what you saw in the former Soviet states. After the USSR collapsed in the early 90s, you saw devastating outbreaks of measles, tuberculosis, and diphtheria. And what we're seeing here in the United States is a steady decline in vaccine coverage. Basically, we're down from about 95% of kindergarten students in 2020 being protected against diphtheria and other vaccine preventable diseases to now it's down 3%, down to 92%. Now, that may not seem like a lot, but about 85% is the threshold at which we start to worry about outbreaks of diphtheria and other vaccine preventable diseases.
Yeah, that's right. And it's pretty, sorry, I had something in my throat. It's pretty insidious when the vaccine rates drop. All of a sudden, things get, outbreaks can spark and suddenly the rates jump up. And it seems like it comes out of nowhere. But if you're watching rates gradually go down, we're seeing this with measles, of course. It really, once you get below a certain protective threshold, then the inhibition of the disease is gone and it just can take off. So I think you're right to worry about this. And some of the new policies coming out of Health and Human Services about vaccine recommendations, particularly this whole idea of splitting up the MMR vaccine into multiple shots, has me worried because so many of these infectious disease vaccine protocols are series of shots. You need to get 2 or 3, and diphtheria is one of those. And if suddenly kids have to get 3 times as many shots, it's going to be harder for parents, harder for kids to come in and get that many shots. And so the vaccine rate is going to continue to go down just by virtue of having more of a barrier to getting vaccinated.
Yeah, and it's really important that you bring up this issue of combination vaccines because the tetanus vaccine the diphtheria vaccine is rarely given on its own. It's often given either as a combination with the tetanus vaccine
That's right.
or in combination with the tetanus vaccine and the pertussis or whooping cough vaccine. And of course, we have seen very high rates of pertussis and whooping cough, which is, to me, yet another sign again that the kids are not getting that diphtheria series, which is normally administered as DTaP, which is the diphtheria, tetanus, and acellular pertussis vaccines that are given to young children. So, John, let's move on to another disease overseas, but this is actually more good news. It's also a vaccine preventable disease, which is Ebola in the DRC, in the Congo. So just last week, the WHO confirmed that the last patient being treated for Ebola in DRC was released from the hospital. And that kicks off what's a 42-day countdown to declaring the outbreak over. And the reason we use a 42-day countdown is essentially it's what's considered 2 of the maximum incubation period. So the time between when a person is exposed to the virus and the maximum time in which they can get sick, it's about 21 days for Ebola. And so if you double that, you're essentially saying, okay, there's no possible way that anybody who has been exposed to Ebola, who's been exposed to Ebola, is actually going to get sick. So we're now in the middle of that 42-day countdown, which is great news for this outbreak.
It's great news. There's a lot of things to celebrate about the control and containment of this outbreak. And we've covered this outbreak on the show multiple times. But what I think is really important to emphasize again is this was a really strong effort by the African public health community and infrastructure to contain what is historically a really bad disease. And it happened in Kasai province, a really remote area with very poor infrastructure. Yet they got thousands of doses of vaccine inside. They were able to ring vaccinate around people. They were able to set up treatment tents and surveillance systems. And it was largely driven by African public health infrastructure, which is amazing. And so, yes, WHO was supporting and was involved, and CDC may have been to some extent, I think early on. I don't know to what extent they were helping out during the shutdown, but largely this is a great effort to contain this disease. So it's great to have good news about this. And I think on our show in particular, it's nice to be able to cover a positive story about successful control of what's, historically a really bad disease.
Yeah, absolutely, John. And I think it's really wonderful to for you to emphasize, to the listeners and the viewers out there right now, just how important this local capacity is. It's both a testament to the progress that's been made
Hmm.
in building up technical agencies, in the science that's been conducted
Hmm.
in the African continent, conducted by African researchers, with the support of communities there. Now, so that is the good news. The bad news is we do know that a lot of that capacity was developed with support. US NIH supported
Yep.
research, US CDC provided ongoing technical assistance and outbreak management and support. USAID has built capacity of community health response, as well as technical assistance, and the Department of Defense, which plays a critical role
Yes.
because it has a self-interest in protecting the military. So I think this is a tale of both good news, but also a reflection on why U.S. government assistance is so important. This is the type of thing we want government assistance to do, and we're hoping we could continue to do that in the future if we can ever get foreign assistance restored to help with so many other conditions where that transfer of technology and expertise can really benefit all of us collectively.
Yeah, and it's worth mentioning, Jay. You and I have both worked very closely, worked throughout Africa, but you in particular really were instrumental in the development of the Africa CDC, right? And you were out there. In fact,
Yep.
that's how you and I met in the first place, was when you were working out in Addis Ababa in Ethiopia, where CDC is located, Africa CDC. But what I'm seeing is that, from the incredibly negative impact of the cuts of U.S. funding, it's just forcing a lot of African countries and institutions to step up. And from having worked with Africa CDC recently, this was a constant discussion. I mean, it's not good. It's very painful to lose all the support and the funding. But I think the only way forward is also that they have had to, coalesce around this. It's galvanized the African public health community probably in a good way. So I agree with you. I think we need to get support back online, but this is a positive that's coming out of it, this, increased self-sufficiency.
There is, and this is where this is one of the biggest problems I have with the current administration is their diagnosis of problems is not entirely wrong, right? The
Yep.
problem is that the treatments they're proposing are horrific.
Yeah.
And
Draconian.
it's yeah. So if you think of it in my medical world, it's like, okay, well, you diagnose this person with a heart condition, but now your prescription for them is bloodletting or leeches
Yeah, that's right.
or injection of heavy metals, things that were done hundreds of years ago. Okay, so the answer to the problem is that US government assistance had become an industry and was not promoting self-sufficiency
Hmm.
and local investment, and I'm a huge believer in that being a problem. It's one of the reasons why the positions that I liked most overseas were the ones where I was actually embedded within a health agency, and I wasn't
Yeah,
primarily a donor. I was
right.
primarily providing assistance to help build and train and build capacity. So that
Technical
is a
transfer. Hmm.
very accurate diagnosis of the problem. The thing is, you don't just suddenly pull everything out
Yeah.
without any transition plan, right?
Right, exactly. There's been very little strategic thought put behind the actions of the U.S. government in terms of how it supports international partners. That's the sad part.
Yeah,
So, we got to hope for a better equilibrium to be found here as we go forward.
exactly.
But back to the Ebola outbreak, I really just did want to highlight that for DRC, this is a great public health win, and they'll be that much better prepared to confront future outbreaks.
Yep, absolutely. All right, John, let's close up our outbreak rounds with something that's both a little bit amusing, but also quite tragic as well, too,
Yeah.
which is there is some monkey business going on in Mississippi. In Mississippi, several rhesus monkeys escaped this week when the truck carrying them crashed on I-59 in Jasper County, about 75 miles east of Jackson, Mississippi. After the crash, the vehicle's driver told police deputies that they were transporting monkeys. Those monkeys were being transplanted from Tulane University, and here's where it gets really problematic. He said that those monkeys posed a threat to humans because they were aggressive
Mhm.
and infected with several viruses, including hepatitis C, herpes, and COVID. So, in response, the police department killed several of these monkeys and then sent out a widespread public alert that three of those monkeys were on the loose and potentially dangerous to humans. So, John, what's going on here? Can you tell me a little bit more about, what risk these monkeys actually pose to human health first?
Yeah,
Second of
yeah,
all,
and I
what about these
think
monkeys that are now in the wild? What is the risk to them as
right.
living creatures and also the risk to humans potentially?
Yeah, a lot to unpack here, including some misinformation that came out initially in this story. So, if it's not widely understood, rhesus macaques are a very commonly used laboratory animal model. We use them to understand all kinds of different diseases that affect humans. We use them to understand how treatments work. And so there are breeding centers in the United States that will breed macaques for biomedical research. And this was an instance of macaques who actually were not infected with any of those things. These are what we call specific pathogen-free animals. They were tested, quarantined, and cleared, and they were actually being transported from a breeding center to another research facility. And it's really tragic what happened. It was a car accident that, this truck tipped over. I'm not exactly clear on the details for what caused the accident, but a lot of the monkeys were injured. From a welfare standpoint, it's what concerns me the most, is that monkeys were injured in this accident, and some of them were killed. And then that misunderstanding that some of them may have been carrying infectious disease prompted, an appropriate response by police for biosafety reasons to euthanize monkeys that were there that were still alive. That being said, the other concern is that there were 3 monkeys that are unaccounted for that escaped. Now, in Mississippi, the climate is such that those monkeys are probably going to be okay. They're not necessarily going to freeze at this point. The temperatures are probably not going to drop low enough, but they will have to forage for food. And yes, macaques can be very aggressive. And what they will likely do is find their way to the dumpsters behind restaurants, to human, residential areas where there's trash or garbage outside. They will start foraging for food, and they're going to find it wherever they can. And what you don't want to happen is for somebody to come out to their backyard and startle one of these monkeys, and the monkey then, bites them or scratches them and injures them. So to that extent, the monkeys are physically dangerous because they can be aggressive and they're strong animals with sharp teeth. And then I worry about that from a welfare standpoint, these 3 monkeys being able to find food and survive in a very unfamiliar environment.
Yeah, no, this is a story that has so many different layers. It gets to the layers of misunderstandings about the diseases that animals carry. It gets to misunderstandings or lack of understanding about how research is conducted, both the benefits and the risks. And then, of course, what happens to animals that were bred in captivity and then are released into the wild in this situation, not intentionally at all. So, John, I really appreciate it. I mean, this is the advantage of us having a show where we have, people with different disciplines, like an expert
Yeah.
veterinarian, to help us understand. Because, what would your advice be if you live in Mississippi or any of the neighboring areas, and you came across, or let's say you're in your home and you look out in your backyard, or you look in your driveway and you see a macaque there foraging for food? What would be your appropriate response?
It's not too different than if you had an animal escape from the zoo. You alert authorities. The police are certainly going to be out looking. Animal control officers are going to be involved. Now, primates are very different than, a raccoon or some other animal that, might be more easily contained, or even bears, where they can, get tranquilized and relocated often when they wander into neighborhoods. So, my concern is that probably the police and whoever else is looking, animal control officers, will probably move to euthanize these animals if they see them, because of the danger they may pose to people just in terms of physical harm and the difficulty it will be in capturing them. I mean, these are monkeys. They'll get up into the trees. They can hide very easily. They're not super large animals, so it might be very difficult to find them in the first place. So probably they'll be I would hope humanely euthanized if they're found, just to protect the public and also for the welfare of these animals, who I'm not sure where they would be relocated to if they were captured. Ideally, what I would love to see happen is animal control officers with anesthetic darts are able to dart these monkeys, safely recapture them, and then they go to a facility where they can be cared for. That's what I would love
Okay.
to see happen. Yeah.
All right. Well, let's hope that happens. Um, And John, okay, so let's switch a little bit here to our focus topic for this week. This is also an animal themed topic. And this gets to a topic that you and I have enjoyed talking about in the past, which is what happens with companion animals like cats and dogs, animals in our home, and the link between infectious diseases that humans get and
Yeah.
those animals can get as well. So today we're going to talk about cats who got COVID from their owners. Okay. So there was a study that came out that was published by Cornell University that reports that New York City's cats, that includes mostly indoor cats, easily caught COVID during the first wave of the epidemic here in New York City. Most of those infections didn't produce any symptoms at all. And the researchers believe that most of those infections were transmitted from a human owner to their cats. And this is based on a study that they did at an Upper East Side veterinary clinic. And it really highlights the importance of thinking about pets both as an individual person, that when I get sick, am I at risk of giving it to my cat, but also when we're investigating and understanding outbreaks of infectious diseases. So, John, can you give us a little bit background about this study and help us put it into perspective? What does this mean for cats and for humans?
Sure. We knew from fairly early on in the pandemic that cats were susceptible to COVID. And there were some studies that came out of China, actually, where they found street cats, feral cats, that had antibodies against SARS-CoV-2. And an important caveat, Jay, for this study we're talking about today is that this was a study of exposure to COVID, not necessarily infection. So
Yeah.
the researchers were looking at cats with antibodies against SARS-CoV-2 virus. And what that means is antibodies, your body produces antibodies in response to either an infection or sometimes just an exposure without an infection. So your body may have an immune response when you're exposed to a virus that never makes a productive infection in your body, but our immune systems are pretty sensitive. So I want to make that differentiation because as we get into this study, this was a study that shows that household cats had antibodies against SARS-CoV-2, and it was presumed that they were infected by their owners because they were tested during the lockdown phase in New York City during COVID. And most of these were house cats that had no other exposure to other cats outside, with two exceptions. But we know from studies in China, we know from a few other studies early on that cats were indeed susceptible. They can get a respiratory disease. There were a lot of studies that came out of zoos. There were cases of big cats, captive lions or panthers that got COVID and succumbed to COVID. They actually got sick and some of them died from the respiratory disease that ensued. So a lot of data came in that cats were susceptible. And the question was raised, well, can we give our cats COVID, but also can they give us COVID? And so
Yeah.
that became a big topic of discussion, which I think is what prompted this survey here, where at Cornell, they decided to look at cats that were being sampled during the early stage of the epidemic.
Yeah, no, absolutely. And I think, to highlight again, you make an incredibly important point. This was not a study about active infections.
Right.
These cats did not have either antigen or PCR testing performed. It was a study of exposure. The good aspect to the study, as you appropriately highlight, is this was a period where most humans were staying indoors, but people were, basically after May, there was, a lot of people were allowed to socialize and do things outdoors. But cats generally don't, particularly cats in New York City. They tend to be indoor cats, right? Because people don't tend to have yards where cats could potentially get it from elsewhere. So it is really important and useful to, again, highlight the fact that, as you and I talk about all the time, humans and animals, we share a common environment. We breathe the
Exchange.
same
Yeah.
air. So we need to always be thinking about each other. We need to be thinking about our pets, and our pets, well, to the extent they can think about it, we need to be worried about what their health could potentially mean for us.
Yeah, I remember during COVID talking, in the media in interviews about, it's protecting your cats, that if someone in your household got COVID, that they should mask and isolate from their pets as well as from other household members. We were really, thinking even back then about the potential for transmission to cats. And at that point, we didn't know how sick cats may or may not get. But Jay, I want to highlight something really interesting. So number one, two of the cats in this study that were seropositive, that had antibodies against COVID, were not strictly indoor cats. One of them lived in a bodega, and that's not uncommon in New York City. You
Yep.
tend to, when you
Bodega
go to
cats,
these corner
very
stores,
popular.
really popular. You'll see a
Yeah.
cat sitting in the window.
Yeah.
It's like the store cat. Maybe it keeps the rodents at bay, which is great. But that cat would be exposed to not only a lot of people, but potentially other cats as well. The second case was a cat that had gone to a veterinary hospital. And so it's possible it encountered or was exposed in the course of going to the hospital. Or, even though it was a lockdown period, remember, there were some people who had essential jobs. And if they worked in the medical industry, if they were doctors or even veterinarians, they might have still been going into their clinic, and they may have gotten exposed to COVID and brought it home to their cats. And so it's an important study, as you say, because it highlights not just that animals get sick from other animals, but that we can bring stuff home to them as well. I did want to bring something else up, Jay, because this is really interesting to me as a veterinarian. Prior to COVID, cats have their own coronavirus, feline coronavirus, that's super common. It probably infects about 50% of cats. It's almost like a common cold type of coronavirus. We've known about it for a long time. Doesn't tend to cause serious disease, but it can mutate into a very nasty form of coronavirus that causes a disease called FIP, feline infectious peritonitis. And that is almost always fatal in cats. When a cat comes into a veterinary clinic with FIP, it used to always be bad news. And they could get really severe fluid in their abdomen, inflammation around different organs, and it tended to lead to organ failure and death. And there was really no treatment for it. Because of COVID, one of the drugs that was developed to help people fight off COVID was remdesivir.
Mm-hmm.
And so that's an antiviral that was effective against coronaviruses. And there is now an experimental drug that was an offshoot of remdesivir that treats FIP, Jay. This is no longer a death sentence for household cats. If they develop FIP, they can be successfully treated and cured. And that is a new thing that I find amazing.
Yeah, that's great to hear, because we often hear about sort of veterinary drugs that are repurposed for humans, right? Well, ivermectin in a bad way, but
Right.
this is a great example of how medical research can benefit every species essentially on Earth, and for things that we wouldn't necessarily have thought about. So, Jon, just some practical advice for we're entering respiratory virus season. If you are a cat owner, what should you do or think about if you yourself get sick with an illness that either is confirmed to be COVID or could be COVID?
Yeah. So look, I think it's, something we can keep in mind if, for those of us still testing for COVID and kind of monitoring ourselves, if you develop COVID, it's a good idea to still keep some separation from your pet cats. Dogs, less so, less susceptible. Cats, definitely susceptible. But importantly, if your cat does develop respiratory symptoms, it starts sneezing, you start to see nasal discharge, bring it in to see your veterinarian. It could be other things as well, but if that cat does need to be tested for COVID, or at least is developing respiratory symptoms that are, worrying, have it seen. There may be some treatment or supportive care you can do, but I'd say first and foremost, if you have COVID, stay away from your cat. Don't let it lick your face. Keep some distance until you're on the other side of the infection, and that'll help keep your pets safe and healthy.
Okay. And can cats get a COVID vaccine just like adults can?
No, unfortunately, there's no vaccine for COVID for cats.
Cat's head. Okay. Well, hopefully that'll be development sometime in the future, especially as we learn more about the potential risks associated with, human-animal, animal-human transmission of respiratory viruses. Okay. And on that note, Jon, that ends this week's episode of Inside Outbreaks. If you're watching, if you're listening, if you enjoy what you're hearing about, you care about public health, please please share these episodes. Please subscribe to our channel. And of course, comment, ask us questions. These are interesting topics that have that can benefit from lots of different perspectives. And so we want to hear from you as much as possible.
Absolutely. We love hearing from you. So please do share, comment, let us know. And, tell us what you'd like to hear us cover in the future if there's a particular subject you're interested in.
Okay, great. Thanks, everybody. See you next week.
Thanks. Bye, Jay.